Ladies and gentlemen, welcome to the MedTech Impact Podcast, where you get to hear from leaders and innovators who are shaping the future of medical technologies. I'm Kyle Cruz.
And I'm Richard Meiklejohn.
And we're your hosts of the show. Today we have with us Wendy Slone, CEO and founder of bTECH. Wendy, welcome.
Thank you.
Awesome to have you here. I mean, Wendy, I think I've known you now for about a year. Super excited to have a chance to share some of your story and just learn more about where you are with the business now. And I guess, honestly, Wendy, when I think of you, I mean, really, we should say your full title, Dr. Wendy Slone. You might be the cleverest person you will ever have on our podcast. A master's degree, double PhD, more than 7 years at NASA Glenn Research, and now inventor turned entrepreneur. I just can't wait to hear more about your backstory. So how did you get started on your career path?
So I finished my PhD in urban studies in 2006, and they asked for people to teach, and I was like, no way, I never wanted to teach, right? And so I said, well, maybe I have the wrong idea, because one of my brothers told me, you got the wrong idea, go and do it. And so I spent 12 years teaching part-time. And in the midst of that, some of my cohorts in my PhD program, we were working together, and we did various types of endeavors of business that all dealt with something in the community, economic development, policy making, so on. And my area of expertise was numbers. So I knew numbers, I knew statistics, I knew data, and it just came naturally. Like, I didn't have to think about it. I used to tutor, and my classmates would be like, you just be out there writing and you knew everything, da, 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 da. And we all back there like trying to catch up. And so I was very proficient at it, and that turned into my first entrepreneurial activity. I didn't even realize I was an entrepreneur and working a business. I just thought I was out here doing the work, and work came. And in that came work with a company here that had NASA as one of their clients. And I started doing some work with them as a consultant, and ended up transitioning, just doing all my work with them as a consultant, because I became a STEM expert and very proficient at it. And so I spent about 5 or 6 years just working with them, as a consultant and handling that part of the business for them. And I decided that I wanted to go back to school and decide, hey, maybe I'll give medical school a try again. And was in a program, there was a dual program going into medical school, and one of my brothers had a stroke. And I said, well, I need to help my brother. And I stepped back and I helped my brother. It also was very impactful because if you had anybody had an illness like that, it takes your attention away from things. And so, I did what I needed to do to help my brother. But in the process of that, and all along behind the scenes simmering, was my mom. And my mom was a diabetic. She started out as a gestational diabetic during pregnancies with my last brother that went into full-fledged diabetes by the time that brother was born. And my mom started having these bizarre illnesses, and she started getting sick. I suspected she was having strokes, many strokes. And it led her to come off from her job. And then things just kind of went downhill for my mom with her health, with the diabetes. And she had an unfortunate fall one Sunday after we came home from church, and she broke her ankle. And when she broke her ankle, they put her in a boot. We didn't think anything of it. They told her to keep the boot on. And eventually that boot, that pressure, all of that ulcer appears. And that ulcer went down to the bone, literally down to the bone. You could see into her leg and down to the bone. And my dad spent time healing that wound, and it took him 1.5 years. My dad became a wound care expert. So notice the trend. Wound care is something that must be in my DNA, because my dad, who worked at NASA in a whole nother different field, became this wound care expert. And then she had another, she had that leg, not amputated, but she had another fall. And now we got 2 wounds going. Same thing, broke it. And within 3 years, I saw her lose both of her legs. And I started thinking to myself and started researching, because that's the, right brain, left brain talking. And I realized that we haven't really changed how we manage chronic wounds or how we treat wounds. Since the Civil War, we're still using the same modality. We just got newer products. And so I said, there's got to be something else out there. And I came across light therapies. And I said, wow, this is interesting. This is fascinating. Why is anybody exploring this? And light therapy has been around since the 50s, late 40s. So it's not something that's new. but it's big, it's cumbersome, it's bulky. Most people can't afford it. And I said, oh my God, we can miniaturize this and we can turn this into a miniaturized device. So the Halcyon Smart Patch essentially was born out of love for my mom. And then the need that I began to see within the community of diabetic foot ulcer patients. So that's a long, short story of how I got started. And then in the process of that, people kept asking me, well, how do you know this technology? And you know, my left brain, right brain geek said, well, people invent things all the time. You know, you don't necessarily have to have a direct path between A and B. There can be A, B, and then you skip all the way over to Z and then you backtrack someplace to D. And so because people kept asking me that, I said, oh, that's okay. I'm going to go and get myself into another PhD program. So we have a wonderful person that is over the PhD program at Cleveland State. And I went and talked to him and I said, you know, I'm interested in coming in because I just want to have this knowledge base. And I got admitted. I was surprised and shocked. I got admitted into an analytical chemistry program. I haven't been taking any classes lately because everything has been focused on bTECH. But nevertheless, the information, the insight, the thought processes, the training from a second PhD, excuse me, is invaluable. And so that helped me to meet some hurdles where people were asking, well, I don't see how you can have this understanding of this knowledge in your mind. But I'm saying I also came from a world that was just full of engineers, chemists, physicists. You know, I grew up NASA, I worked NASA, you know, so I'm surrounded by STEM. And if you don't have any thoughts, you're gonna have some thoughts, STEM related. And so I feel that, you know, education has been a wonderful door and an opportunity, and it has afforded me to be able to explore my interest and my love for my mom in developing a product that can help beyond her and help beyond even, excuse me, diabetic foot ulcers.
Incredible, Wendy. I thank you. And that story is remarkable. And I think, you know, a lot of times when you're talking to innovators, entrepreneurs, you know, oftentimes it's kind of something that's happened in their life that has, you know, directed them to pursue a certain area of expertise or specialty, looking to address a much larger problem that's near and dear to their heart. So, you know, it's a beautiful story. And just thank you for sharing. I guess you know, it's interesting working in this medical device industry and understanding a lot of this light therapy. A lot of that's laser light therapy, I think, that we see a lot of. I'm curious if you could maybe touch a bit more on the patch that you were able or develop or you're developing today, and kind of touch on how it would leverage light in the patch to treat those foot ulcers.
Yeah, so I want to like start off by saying and being real clear to the listeners that our device is not a Band-Aid. It's not a second skin like a Duoderm. And sometimes people often want to clump it in those areas because that's what they understand in the wound care space. And because it is a patch, technically, because you apply it like a Band-Aid, they want to put it there, but it's actually a device because it does not go on the wound bed. It goes in the vicinity. So let's say if you have a diabetic foot ulcer, you can put it up on the calf. You may be even able to say, I can't put it on the calf. I want to put it on the thigh. I want to put it on the back of the wrist. I want to put it anywhere. And that's because the device mechanism of action is after increasing microcirculation. So I'm just going to talk at a high level about, you know, what the device does. So we use a biopolymer nanomatrix, and biopolymer is just a fancy way of saying we use something that's from nature. So we use a conduit that's from nature in order to build what is the patch itself. And then we infuse it with the whole nanotechnology and the far infrared. Far infrared, people are like, well, how can you harness far infrared? It's easy. We can roll it through the machinery that we use. We can use an external light source and we can impregnate it. And then our proprietary patch has components in it that allows the far infrared to be held. So similar, if you've ever used a lidocaine patch, which is called salon patches or icy hot,
Sure.
They do the same thing. And so they take that lidocaine, they infuse it onto that patch, and when you put it on your body's heat releases it. It's the same thing with our patch. When you put it onto the body, the device releases the far infrared. Now, here's the thing, the beautiful thing. Far infrared, let me just demystify that, is the sun. It's like sunlight. And so you can buy, if you ever bought a far infrared lamp for your home, if like I have a far infrared sauna, if you bought anything that a far infrared piece of clothing, it's infused with far infrared light. It's just a bandwidth of wavelengths. And so you can infuse that into different things in nanotextiles. And in this case, it's in a device that actually just looks like it is the size of a Band-Aid. Excuse me, and the body's ambient body temperature releases that into the skin. Now, when it releases the far infrared off of the patch, the body takes it and transforms that infrared light, that far infrared light, into radiant heat. And that's the same thing our body does with the sun. So the body is just, it's like if you go from a ice situation to a solid to a liquid to a gas, it's that same principle with heat energy, light energy. It goes from stage to stage. And this is what happens with our products. So it goes from that far infrared to what the body recognizes as radiant heat, and that small radiant heat stressor causes a wonderful reaction in the body, which is a natural reaction, which is at a 30,000 foot range, the increase of nitric oxide. Not the nitric oxide where, okay, it's going to cause problems with potassium levels in your body and all of that. It's a good response. It opens up as a vasodilator your veins. So more oxygen, more nutrients can flow in. With more oxygen, more nutrients, what's going to happen is that you're going to get more cellular deposition, meaning you're going to get more skin being re-epithelialized into that wound. And guess what? That skin is going to be stronger. That's key, because when you cut yourself, if you got any kind of wound, it normally, without being a diabetic, that wound makes that skin compromised. So it's lost what we call tensile strength. But if you are a diabetic, you're going to lose a whole lot of that tensile strength. So that's what happens, when the reason why those wounds reoccur. And they reoccur in a bigger area than where you normally had the first wound at, because the skin has become weakened. So our focus is increasing microcirculation and increasing that skin strength. So now you've got a better chance of that wound not reopening, not sliding on a banana peel down to an amputation. So that's our focus: increase microcirculation by increasing nitric oxide to help prevent the amputation.
You are amazing, Wendy. Is this now? I know this. It was developed, through, obviously looking for a solution for your mother. But could this be used in any kind of wound that you have at any part of your body,
most
right?
Definitely.
So this isn't just foot ulcers here. This is
not just foot ulcers.
Yeah. Okay.
Foot ulcers is our market entry because of my love for my mom.
Sure.
But it can be used for any wound. So the chronic wound market is a $12 billion TAM industry, right? So that means that it includes diabetic foot ulcers, burns, non-healing surgical wounds, dermatological issues. It can be pivoted over for those same types of wounds in animals. So veterinarian, it opens up that field. I've had cardiologists say, hey, because you're increasing microcirculation, this might be something we can use for our patients who have impeded vascular flow as a result of their cardiac issue. Can we use it for that? All of that is yes. So again, this is why it is a device and not a Band-Aid, if that makes sense, because it has so many ways that it can be used.
Yeah, and tell us, I'm sorry, Richard, I have one more question, and I'm super curious. What's the patient experience like? You mentioned that it doesn't have to go directly on it can go anywhere on the body. How does that work?
So it can go anywhere on the body, because if it might, vascular system doesn't care when you begin to, stimulate it to open up those vessels. So if you know anybody, for instance, that's taking blood pressure medication, it's the same thing. They take that pill, it goes into the stomach, but the effect is systemic. So it's body wide. So that's the same thing with this. It has a body wide effect. So if you put it closer to the wound, this is what we would test in our clinical trials. If you put it on the calf and the wound is on the ankle, the proximity of it is what we are looking to test out, but we won't know that until we do the clinical trial. So right now we've done some preliminary animal testing. We've built the device, so we know how to build it. We know we can get epithelialization. So we know all of these things things work. So we are really interested in getting it first in man. And to that point, we are actually doing our FDA pre-submission right now, working with Arcumus to help us go to FDA and say, this is what we've done, this is what we're thinking. What are you saying? And what is your guidance and your leading and how we should move forward with this? In addition to that, we're doing our reimbursement code assignment. So we're looking, I'm working with our Argenta advisors to help us look at that as well, so that we know all of these things moving forward. And to that end, we are working with some podiatrists who are on our team to help us be able to have patients that we can be able to bring into clinical trials, but then also get their feedback on, hey, does this work for you as a clinician? Do you think that this would work? Because again, we are not trying to replace any products. We're coming in as a complementary product. So we want to be a part of a family of ways that you're treating wounds, but we want to be a way that help close expeditiously so that you can help prevent infections, reduce hospitalization, and then more importantly, bring strength to that skin that's been epithelialized. Generally, if you don't move into an amputation right after that diabetic foot ulcer and there's a lag, you're more likely to get that reoccurrence of that wound within 1 year. And so I seen that happen with my mom. And so, and not only did the wound come back, but it was bigger. And so how do you begin to prevent that? So this is why we focus on grades 0 to 3. When we're talking about wound healing, 4 and 5, you're already at gangrene, and you're probably at the place of amputation anyway. So we want to be preventive, and then also help during the process of any type of stage of healing up into that stage 3.
Now, Wendy, you always do such an incredible job of explaining to me, which I'm thinking about, this is like deep science, and you make it sound so simple. So I have a couple of questions for you. One is, I'd love to know, is there any reasoning behind the name of the product, the Halcyon Smart Patch? And then second to that, going beyond this science you're talking through, what are some of the challenges you face in actually bringing this product to market?
Yeah, Halcyon just sounds cool, right? But actually Halcyon just came about because our engineer, that was the project name he gave it. And I thought, that's a cool name. Why change it? Why book the, the name of it? It fits for it. And so that's how that came about. One of our major, my only challenge at this point in time is funding. Funding. Yeah, that's the biggest challenge. So far, we have been able to bootstrap, and we've had wonderful strategic partners and affiliations that have come along and provided in-kind services, provided all kinds of assistance to us. And we could not be where we are today without that. Programs like the UMass Impact have been phenomenal supporters of us as a business, as a startup, as a female minority-owned business. I cannot ask for anything more. I mean, I'm always pushing people towards, like, if you don't think about an accelerator, think about one, and this is the one you should think about. And so I'm very happy with what support we have gotten from UMass, Impact, of course, BARDA, and now with the Johnson & Johnson Innovation. We could not have asked for better partners to help us.
Well, cool. That's great to hear, Wendy. I mean, I think for us we're fortunate to work with you. I feel like ever since I've known you, you're just, again, the epitome of an entrepreneur. You're going out there and making it happen. You put in so much effort, and for us, it's like a real joy to work with. And so we've been super excited to see the progress you've made. And so again, back to that funding question, what do you kind of see or feel are the problems you're facing in going out and getting money? Because of course it's a difficult climate, but again, do you see any particular challenges that you're facing?
Yeah, it is a difficult climate, but I think the biggest issue is because it's a difficult climate, investors are looking for that much more de-risking. And for us, we know 2 areas that we want to de-risk, that are easy for us to de-risk, but we need the funds to be able to do the research to de-risk them. And that's the biggest hurdle. I'm hopeful that we can, get beyond that and find a lead investor that would do that for us. But I'm also always looking for creative ways to get to that next milestone place for us, so that we keep being on track for release of the product by 2025 into the commercial space. So one of the efforts that we are doing in the de-risking pathway is looking at the FDA pre-submission, looking at the reimbursement codes, looking at being able to become revenue generating, even doing clinical trials. If we can identify codes or apply for a code, what that will look like. And then looking at, building partnership and relationships with other entities that may be able to walk with us. So say we gave up some equity and say that, hey, we'll take on helping you get to that next data crunch milestone that will help to further de-risk the technology. So always to me, as an entrepreneur and as a founder, you have to think outside of the box, and not look so much at the obstacle like, oh my gosh, I don't have no funding. Yeah, okay, I don't have any funding, but what else can I do? How else can I keep marching forward? How else can I keep the business viable and attractive as we are still, fundraising, but there are things that we still need to do, so FDA, reimbursement, human trials, factor analysis, all of those things, all of these are things that still need to be done. And so just keep those projects moving as well. And don't get hung up on, I need funding. But if I'm asked, I'm gonna say funding.
Yeah. And Wendy, this is a 510K submission?
Yeah, so right now we think it's a 510K class 2 device. And so we're looking for clearance. But again, FDA, I'm in the trenches of the FDA pre-sub application on my side. I have work to do in it. I'm almost done, thank goodness. But we think right now it is. And we did a wonderful program called bTECH MedTech. I just want to give them a shout out. And bTECH took the chance on having a cohort that was just focused on Black founders. That is phenomenal. Let me just park there and say that's phenomenal. And Boston Scientific and BARDA were involved with that. And Boston Scientific provided us huge assistance in looking at predicated devices. I went there and I had 3 wish list items, and that was one of them. And they came through with flying colors. So that helped us to begin to look at where we were at in terms of FDA as a class. So, Richard can show and test. I'm always like, I know exactly what I want, and I know exactly what I and then if I learn something, I come back and say, I think I need that too.
Absolutely. And I have to say props to bTECH, because that's how we first met. So we saw you pitch there, we followed up, we had a conversation, and we were very grateful that you came and you applied to the impact program. So that was cohort 2 you applied for earlier this year with BARDA. Now we're delighted to have you back in cohort 4, where we're working with Johnson & Johnson Innovation. And super excited to again bring you back for November 30th, where we're going to be having this pitch-off event, where we're going to let all these innovators tell their stories. So I guess for you, having been through these programs, what's been your biggest takeaway? What have you learned from them?
Know what you want and not be ashamed or afraid to ask for what you need. I think especially as female founders, I find a lot of female founders, and particularly minority founders, waffle around what they need and waffle around their ask. And you cannot do either. You need to ask. You need to stand by while you're asking, and be sure that you're asking for the right thing. And then you need to be willing to take advice and be willing to take correction, being willing to take input as well from people who know the space, who know the climate, and not think that you have how can I say, it's not have a market hold on what you know, because if you do, then you won't go anywhere. And as an entrepreneur, I find that your position should always be one of being like a sponge and being receptive to soaking up knowledge, So I liken it to when I was in my PhD program the first time. I will be like, I'm just gonna suck up everything, not only because I'm paying $1 million for this, but I'm here to suck up all the knowledge that you have. And then when I got towards the end of the program, I felt like I was saturated. I felt that I had gotten everything that I needed. And that's how I knew that I was ready to go and go out into the world and be a a practitioner. And I realized that that's the right evolution. And that's the same thing with a business. You have to be willing to suck up as much knowledge, as much understanding. And if people say things, ask them for clarification, ask them until you know and you understand it clearly. And don't be afraid to take rudimentary steps. Sometimes I find that especially scientist entrepreneurs don't want to take rudimentary steps. But I learned when I was pursuing my first PhD, it's okay to say I'm having a Barney Rubble moment. And if you know anything about the Flintstones, Barney's eyes were nothing there. I don't know. I'm trying to gain and glean some information. And I would hear my classmates say to me, oh, you shouldn't have asked that. I said, well, do you know? And they were like, no. And I said, but did you gain something from my question? Yes. And so that's what I feel about this process. I want to gain as much knowledge. I want to be as best as I can as an not only as an entrepreneur, but as a founder and as a CEO. You know, at the end of the day, I'm trying to build a business that has a product. I don't want to have a product that I'm trying to build a business around because I'm in it for the long run. I see bTECH as having a family of products based on this one technology. So how do I roll that out and become the next Coke? You know, Coca-Cola with the Coke Wars in the wound care space so that I can have families of products that can help reach more people that are in this chronic wound space.
You know, you're right. That complementary approach, I think, to help increase the success rate, right, and the healing process is so incredibly important, especially if you know your product too can be at a competitive price point. And so I guess I'm curious too, like, is there kind of like a target price per patch right now that you're kind of striving towards?
Yeah, we do have a that's a good question, and thanks for the compliment and comment. Yeah, we do have an ideal pricing. So for instance, right now a bariatric chamber what they call it when you go in for the bariatric, it's like one treatment. It's about $250, $250. So we don't want to price too much more over that. That's a device that's in our space. Laser therapy treatments vary in their costing. So we wanted to try to pick like an industry standard that brings oxygenation again to the wound bed, which is part of our modality of bringing oxygenation increased by the increasing the microcirculation. And so we're looking roughly now at about $160 per patch with a box of 5 patches. And we're estimating that it would take you about 5 patches per wound to close it. And when we're talking closure, I'm not talking just like surface closure, we're talking closure of the wound. So some of the current technologies that have been out here for a long time, they're great and they're wonderful, but this is how we can complement them. And that while they're closing across the surface, and then all of that other stuff is still happening beneath the surface, and that wound is still susceptible to infections. If we're being used, this is our thought process and our hypothesis, then we can come and help heal from the inside out. So that's one of our taglines, healing from the inside out. So now you've got double healing to me in my mind. So you've got something that's closing, you know, efficiently, even though it's taking a little longer. We can help expedite that external closure at the surface too, because of how our product is constructed and engineered. But now we can also help heal it from the inside out. So why is this important? Because I give an example. I broke my ankle in 2011 and I had to have surgery. So I still to this day have a plate and pins in my leg. And the surgeon said to me, well, Miss Slone, this wound is going to still be healing several years out. And I've said, brother, you don't know what you're talking about. You just cut me open. You just put some hardware in me. And he was right, because the wound was still healing from the inside. And so it closed on the surface. But I had a little like hole that opened up at the end of that incision that I was like, oh my God, I hope I don't get an infection. But because I wasn't diabetic or anything like that, it closed up and it was no problem. But I look at, that's what happened with my mom. She broke her ankle. They put a little stabilizing pin in there. They pulled it out. The wound that they made was about this big. You could barely see it. That little wound went to a wound that was this big in the side of her ankle. We have pictures of it down to the bone. And so how can you prevent that? It's by healing from the inside out and then meeting where the current technology is. I liked what you said about other new technologies that are coming on. So I like to follow and track, and everybody in my family, friends, and know about bTECH always sending me stuff. Have you seen this device? Have you seen this? Yeah. And I'm like, yes, because I'm out here following. So I keep a folder of things that are out here, not because I'm also looking at my competitors in the space, but because I'm interested in knowing how new technologies, biopolymers are a new and an innovative way to treat wounds, to treat cardiac issues. I mean, there's so many things you can do with biopolymers and nanoparticles. And so I'm excited to see how the field and this whole sector is beginning to be changing, which we've needed a change because we haven't done anything since the Civil War to change it, correct? Yeah. So it's great to see. It's great to see. And I'm glad to see it. I'm glad to see other products come in. I'm glad to see things come in that are dealing with surface epidermis layer. I'm glad to see other products because we need these products. The patients need the products. Sure. And our healthcare providers need other tools in their belt. This is why I'm saying that we're a great complementary product.
Absolutely. And you know what, you're going to be able to probably help reduce the number of other types of procedures that multiple procedures that might be needed too with your technology, and you know, help reduce the number maybe of visits to the hospital, right? And help again expedite the healing process. So you're saving time, you're saving visits, you're saving a lot of money. And you know, when you talk about that price point, you know, in the med tech, you know, industry, it's not staggering, right? It seems like it's a competitive price point that's going to produce significant results in savings for the industry, for the healthcare industry, for doctors, for hospitals, for the patient themselves. It's really impressive. So thank you, Wendy, for sharing all of that.
Yeah, I think you're doing amazing things. And again, when you're talking about being an entrepreneur, it comes across so clearly about how immersed and how passionate about your product you are. Obviously, this personal story of why you started. And I wondered, kind of reflecting on all these things, if you were to give advice to other entrepreneurs, what are the kind of the key things you look on and look back on your journey and say, these are the things that people should really know about, be prepared for, or those sort of tips for advice to go forward?
My biggest advice, and maybe this is the old teacher in me, is I used to tell my students, go back and analyze why you got that question wrong. And it's not because of the lack of knowledge, but what were your processes and thinking? And then how can you change that around so that if you see that again, even if it's worded differently, you're able to get it right. So here it is, it's a teachable learning experience. So what I tell entrepreneurs, and I tell particularly even female founders, because I'm currently doing the Capital Network Female Founders, we're wrapping that up. And so I was just talking with them this morning and said, don't be afraid to fail. Society tells us if you fail, then, you know, you just are a loser. You can't do anything. You'll never rebound, you know, all of the negative things. And failure is actually growth. Failure is actually progress. Failure is actually success. But if I look at it and I meditate on it as failure and I internalize it in the negative way, then I am going to fail. And I am going to be that loser that I don't want to be. But if I ask people and I'm open enough to be taught and say, I don't understand why I'm not getting no funding. What can I do to change that scenario? And it's something tweaking small in how I'm presenting it. And I'm like, oh, and so now I've learned from a failure. And now it can become a positive and become a success for me. So my biggest advice to anybody is don't be afraid to fail. Look for the success in that failure.
It's such great advice. And I think as well in science, like science is failure. You know, you have 99 experiments that fail to prove that one time this is the way that works. You need to validate. And I think, again, it's such great advice to say to other people, don't be afraid of that. It's a journey and you will get there if you persevere.
Yeah. Yeah, it's time and perseverance and then it's also the timing. So it may not be your timing right then, but your timing will come, because when you look back over it 6 months ago, I'm not where I was. So like one of the questions today during our meeting was, oh, 6 months ago, where were you at? I said, I was busy. Where are you at today? I'm even busier. And so this is good. So I can see and I can trunch and see progress. And we should be able to see progress and milestones in what we're doing as entrepreneurs. And so we have to look above sometime, not be so entrenched down where, you know, it's just face down, dirt up the nose. You need to be able to pull back 30,000 feet, 50,000 feet and see where you have been making progress and where you're moving. And then put that all into a master strategic plan. Am I meeting my master strategic plan? So our goal is to come to market by 2025. That part of that is not only you know, market entry, but it's also bringing in how we can get revenue started as part of our clinical trials effort. And so all of that is part of our roadmap to market entry. And now when I talk to other entrepreneurs, they're not even thinking about that. And I'm like, so there's so many ways. Don't be locked in. It's almost like being landlocked. Don't be locked in. You know, so I grew up near a body of water by Lake Erie. And so here we don't have that mindset. It's just growing up on bodies of water. And I know you guys know this from Massachusetts. You have a different mindset about how to navigate because you're not locked in to a place where you can get from A to B. And that's how you have to be as an entrepreneur. You can't get landlocked in your thoughts and in your processes. So failures are going to happen. That's okay. Don't internalize things. Don't take them personally. Use them to grow. How can I better my pitch deck? How can I better my pitch? How can I better my presentation? How can I get more exposure? How can I build my network? How can I, you know, all of these things, and then be smart about it.
Absolutely.
Yeah, Wendy, you're an inspiration. That really is incredible. It's clear why you're in the position you are in today, why you're a real true leader. And just congratulations on everything you've accomplished to date, and the people like you just making this world a better place. I guess, you know, people are going to hear your story, and you know, that's our hope, right? We want to get that out there. You know, if people want to get in touch with you, what's the best way to do that?
Yeah, so my email address is wslone, and I spell my last name SLONE at bTECH, BTECHLS .com. And they can also reach me through LinkedIn. I'm out on LinkedIn. They can you know, network with me there. Been getting a lot of hits there where people ask to connect, and then I'll just send them my you know, email address if they didn't catch that. And then they also can go through our website, which is btechls.com, and they can find us there. And there's the bottom of the page, there's a sheet where they can reach out, and I do respond to all of those.
Oh, fantastic. And they can also see you at the Impact Pitch Off on November 30th at UMass Lowell, the Innovation Hub. So you can't forget that. Wendy, this was a real pleasure. We can't thank you enough for taking the time today. So just amazing conversation. Again, wishing you all the very best. And with that said, we're going to be signing off. And until next episode, once again, this is the MedTech Impact Podcast. I'm your host, Kyle Cruz.
And I'm Richard Meiklejohn.
And until next time,
keep innovating.